guys, it's Hina here at Rebalance Physical Therapy and Wellness in Narberth, Pennsylvania, as well as in Philadelphia, Pennsylvania. And I want to talk to all of you men and women who might be having bladder issues of feeling like you have to go to the bathroom right away, which is called bladder urgency. Feel like you just cannot wait, you got to run to the bathroom. Bladder frequency, meaning like you know where every rest stop is on the highway and you stop at every rest stop on the highway. And then also bladder pain, meaning when you feel like your bladder is starting to fill or even empty, you guys start to have pain right in that lower abdomen around that bladder. And so for some of you, you might feel like you also have like a urinary tract infection all the time. So whether you have bladder urgency, frequency, and pain, or some combination of that, though, I hope that this is a video that's going to be helpful to all of you, because I'm sure some of you probably know what this condition is, but some of you might be like, hey, I have no idea, but I know like that's what I have. So first of all, you know, your bladder, ideally in a normal bladder, most people should be able to hold their bladders if they're drinking normally throughout the day, okay? You should be able to hold your bladder for about 3 to 4 hours. That's quite a long time, but you should be able to do it. And when you pee, you should be able to pee for about 12 to even 15 Mississippis, okay? So if you are having any less than that, okay, where you feel like when you pee, you're going often, but when you pee, there's like only 5 Mississippis worth of going to the bathroom, and then you have to go again, and then maybe it's like 3 seconds worth, okay? Then this is called bladder frequency, all right? It means that it is not normal for you to have that. Now, for many of you guys, you've probably, you know, some of you are just like, oh, I just thought that's me and I just go to the bathroom all the time. No, you probably actually have a problem that needs to be addressed, or you should get addressed, because it could end up causing other problems. So normally, that's how most people should be going. 3 to 4 hours. You should be going 12 to 15 Mississippis of urinating. Okay, that's about 12 to 15 seconds. And you should not have any pain when your bladder is filling unless you really allow it to fill and there's no place to go to the bathroom. And then yes, it's because your bladder is just overfilling, okay? But again, then when you pee, you're gonna be like peeing 20 Mississippis, all right? So if you are having bladder frequency, urgency, and pain, now that you know what it entails, then this is actually a problem. And it could be a problem of the muscles in your pelvis, okay? And here's your pelvis, all right? Many people think this is their hip, but it's not. This is your pelvis. Your hip is actually much further down below and through here, all right? Now, there's a group of muscles inside your pelvis, right in through here, called your pelvic floor muscles. And these muscles, not many people can see from the, actually, you cannot see this from the outside, number one. You can't see it on the outside. But many people don't even realize they have muscles in this area. But for those of you who have heard of the word Kegel, these are the muscles that you're actually contracting when you think of doing a Kegel. And these muscles, most people think are weak. You think of, oh, if people have incontinence and you accidentally pee on yourself, that's because you have a weak pelvic floor and you need to do Kegels. But for many of you who are having bladder urgency, frequency, and pain, you're actually having the opposite issue of these pelvic floor muscles. You're actually having tightness and spasming of these muscles. And those muscles, okay, because they line the inside of this pelvis, they can affect your bladder, which is right over here. They can affect actually problems with sexual function, and they can actually also have problems with pooping and constipation and irritable bowel syndrome. So these muscles can actually have a real big problem on all of these muscles of the bladder, the uterus as well, or not the uterus itself, but the vagina and the rectum. And these muscles really can just cause a huge havoc on many other issues, and they can be causing these bladder issues that you're having. So some of you probably have gone to your urologist, you've talked to your primary care doctor, and they're just like, there's nothing wrong. And maybe some of you have gone to a specialist and they say, okay, you've got problems down there. Here's a bunch of different medications that we might be able to give you, but you're still having this problem. Well, just know that these muscles down here are the problem. Now, why do I know this? because I'm a pelvic floor physical therapist that's been working with issues of bladder frequency, urgency, and pain. For 21 years, I've been working with problems in and around this pelvic area. And we've treated hundreds of people, if not, I would say at this point, thousands of people with problems down in this area, and hundreds of people that have bladder urgency, frequency, and pain. And this can be successfully improved and possibly eliminated with the right type of treatment. So I want you guys to know, any of you guys who are feeling this way and you're just like, yes, that's what I have, but I'm running around from doctor to doctor because nobody understands how to treat it. Maybe you've been told it's a pelvic floor issue, but then no one has guided you to in the right direction. Or unfortunately, some of you have seen a pelvic floor physical therapist, but so many times I do lots of calls with lots of people around the United States and actually the world, and they've said, I went to a physical therapist and they didn't do what you're telling me should have been done. So for any of you who are having this problem, the primary focus of this video is to let you know this could be the major issue and that there is help out there. Now, why does this happen and what can be done for it? Well, I'm gonna actually direct you to another video, because if I talked about all of that, I would be talking to you right now on this YouTube video for like 30 minutes. So what we've done, because it's so important to really understand what's going on with yourselves and empower you, is we've actually created a link below. So you'll see it's the online program for female and male pelvic pain. If you click on that, there is a free 30-minute PowerPoint where I go over how all these things could be interconnected and how it's actually interconnected with the hip and the low back and the abdomen, okay? Because people don't realize that. And all the different issues that can be caused with problems not only with your bladder, but other things that could be involved that you may not realize that is actually you. And so please watch that video. Even if you decide not to do our program where we teach you how to treat this, even if you decide not to do this program, then you're gonna be empowered no matter what, because you just have more knowledge, and knowledge is power. I know it sounds so cliche, but it really is, because I hear it over and over again where people are going from doctor to doctor and no one's actually explained this in such a clear, concise manner. And all the comments and the feedback that we get back constantly, even after doing our case management calls, is you're the first person that has actually understood what's going on, and you're making me feel so much better. My anxiety level is less because I know that there's at least one person out there that understands what is going on with me. And they take that information and then they can utilize it in whatever way that you wish. So I hope this was helpful for some of you who are having these issues and you're just wondering what the heck is going on with me. Perhaps this is the 50th video you've watched, or the 50th, blog post or something that you've watched, but for many of you, it might be the first. And so if this is the first, then congratulations, because I've just saved you a lot of hassle in trying to navigate through this bizarre world of pelvic pain and bladder and all this weird stuff when there's no problems actually in the organ. It's actually a problem in the muscle. So I hope to see you in the PowerPoint presentation, and have a wonderful day.